Hello and welcome to Natural Healing with Oriental Medicine. I'm Grant Boxleitner and I'm joined by Dr. Stephen Wrench of East West College of Natural Medicine. We'll be discussing Tui Na. Right now, though, I'd like to send it out to the president of East West College, Russell Badiata.
Thank you, Grant. Thousands of years ago, the Chinese developed a system of therapeutic massage known as Tui Na, which means to grasp and push. Its focus is on massage using specific techniques along the meridians associated with the practice of acupuncture, along with the adjustment of joints and bones, similar to modern-day chiropractic. Tui Na utilizes a myriad of specific techniques to bring about the desired results for specific syndromes.
Thanks, Russell, and we'll be checking back with you later when we see a demonstration of Tui Na. So, Dr. Wrench, I want to start very basic here for folks who may not know. What is Tui Na?
Well, Grant, Tui Na is a Chinese word that means actually to push or grasp. Tui is more or less pushing, and Na comes from the concept of grasping. It's a very, very old form of body therapy or manual therapy, if you will, a medical type of massage that's been in China for a long, long period of time.
So stimulating the body in the hopes of healing, or it's been proven to heal the body as you do it.
Absolutely.
And so this dates back one of the first forms of massage?
It is considered to be kind of the granddaddy, if you will, of all massage, at least of all types of Asian body work. And the historical records indicate that Tui Na has been around and was first mentioned about 1700 BC.
Oh, that goes back a while.
It does go back a while. But you know, we think about, when we think about pain, what happens when our body hurts, we almost always will touch it. And so we believe that, just like today, when something hurts, you put your hand on it. You pay attention to it.
Right.
And so through trial and error, just like Oriental medicine evolved itself, it was a method of touching the body and finding ways, trial and error, different ways to do it, to push, to pull, to press, to roll, to drill a little bit.
And does that then encourage the blood to come there and healing parts of the immune system to generate in that area?
Well, it can. One of the interesting concepts of Tui Na is that it's based on meridian theory. So when we do a regular massage, much like a Swedish massage, kind of feels good and everything, but and not to downplay the importance of any other type of massage. But the roots of this medicine are thousands of years old, and as we've talked in prior shows, when the Chinese began to map the body, they began to discover that there was a connection from one end of the body to the other. And we believe today, we know for a fact, because these channels that we refer to are like little energetic superhighways that traverse the body longitudinally. They run from top to bottom or bottom to top.
A series of networks, if you will.
Absolutely, almost like a blueprint along which energy flows through the body. We call this, and this is one word that we use that many people are now getting used to hearing and are very familiar with, but the concept is of energy in the body. We call it chi, or life force, or vital energy. And when chi flows through the body, just like the electricity flows through the walls here in the studio, if we have a short circuit, if a wire accidentally gets cut or broken, then energy doesn't get from point A to point B. And we're kind of wired like that, Grant. If the energy isn't moving through the body, it more or less will stop. And when it stops, there's always pain, and ultimately it can lead to disease.
So if there's a roadblock and this isn't flowing freely, then that's when you have the problems and Tui Na can be administered?
Absolutely. And again, to give you kind of a different analogy, if we think about the interstate highway system, it's kind of like that. And when we have an accident on a highway and two cars may collide, and then the law enforcement arrives and we have a stoppage. And so the poor guy that's 5 miles back, he knows he's there's something going on way up ahead, but he doesn't know what's happening. All he knows is he's not moving. So when we when the law enforcement guys come and they clear the wrecks and they get the traffic flowing, you have to understand that's like a little bit of Tweenah. But the guy that's 5 miles back, he doesn't realize that this is moving for quite a while. Then all of a sudden the cars in front of him start to move and he goes, ah, finally.
Yes.
But this was a process of moving vehicles off the road and so on, so everyone can resume the normal flow of traffic.
Now, we talked about how long it's been a part of traditional Chinese medicine, but this has graduated since to the West, right?
Oh, absolutely, it has. I will say that, again, just to touch on this meridian system, when we think about massaging the body, we really just think about kind of improving lymph flow and blood flow, and it feels good. It makes muscles more supple. It relieves what we call hypertonicity, which is when muscles are hypertonic, they're knotty and knotted up and so on. They're overly tense. But Tweenah, based on the idea of the meridian system, we understand the flow of energy in one channel goes this way, but in its counterpart, it may go exactly the opposite direction. So the techniques are somewhat, and I'm really oversimplifying, but they are geared to move energy in a certain direction using a certain technique to treat a certain body part with a specific technique. So it's a little bit more involved than just a normal massage.
So the grasping of each part of the Tweenah technique is different and accomplishes something different.
Yes, and Tweenah is not just for muscle pain, while certainly it can treat all kinds of myalgia, arthralgia, it can treat sciatica. It also can treat digestive disorders, gynecological disorders, and so on.
As far as differing from other types of massage, there are, you mentioned Swedish, but there are so many different types of massage, but Tweenah certainly is its own thing.
And let me tell you why that is, because in China particularly, Tweenah is a licensure like acupuncture. It's quite a lengthy process. It's not a 6-month course. It's a 4 to 5 year program. So that person, when they come out of their school, has the status of a physician. And it's because they have learned so much about the body and understanding how to use what techniques on what particular body parts, depending on the type of pathology that they're dealing with. They understand the meridian system, they understand the diurnal clock, they understand the chi flow system, and so there's a lot more to it.
So the training is pretty in-depth then?
It's very in-depth. In fact, and this is a little known fact, but it's often said that Tweenah is the father of chiropractic. Because in China, Tweenah practitioners do what osteopaths or chiropractors do here, or even orthopedic surgeons. They actually specialize in bone setting is one of the things that they do. When there's a very, very bad fracture, they'll have a Tweenah practitioner in, they'll look at the x-rays, they'll talk with the orthopedic professional, but the Tweenah practitioner will actually set the bones.
Very interesting. And don't go away. When we come back, more questions with Dr. Wrench, and then we'll go back to the college to see how this all works up close.
Opioids are now a public health emergency in Florida. So what have you been prescribed for your pain? East West College of Natural Medicine understands the age-old Eastern philosophy of natural healing using acupuncture, herbs, and massage. Here, we combine Eastern and Western healing that results in a unified solution, individually tailored for you.
Massage is a powerful tool. It can alleviate pain, heal injury, and support well-being. East West College of Natural Medicine can prepare you for a career as a massage therapist. Our curriculum combines Western and Eastern massage therapy approaches, and the program includes an internship and job placement assistance. Launch a career you can feel good about. Start at ewcollege.edu. East West College of Natural Medicine, nurturing careers in the healing arts.
Welcome back to Natural Healing with Oriental Medicine. When we were just talking a few minutes ago, we were talking about bone setting, and you were making some interesting points, Tweenah versus chiropractic.
Well, it is often said in China that chiropractic came out of Tweenah, as we said earlier, it's 1700 BC.
Yeah.
So they figured out over time, how to handle many different kinds of very complex fractures and so on. But along with that was that we have 206 bones in the human body. We have about 640 muscles in the human body. And one of the jobs of the muscles is to maintain structure and support, to keep bones and things where they're supposed to be. This is done
Keep
through,
them aligned,
through ligamentous
keep them-
structure and also through musculature and so on. But you can't have 206 parts moving kind of independent of one another and not have things move out of place every once in a while. I'm a big believer in chiropractic. I've been having it my whole life. So every once in a while something gets moved out of its natural position. We call this a subluxation. So it should be here, but it's a little bit over here. So the job of the chiropractor, for example, and I won't pretend to speak for them, but is to adjust the body very gingerly and to move things back into normal alignment, hence rebalancing things. What happens, for example, and we've all had back pain in our life. In fact, Americans, if you're living in this country, about 80% of all of us in America are going to have back issues in their life. I'm one of those stats.
Feel some of lower back pain, upper, just all over.
So what happens every once in a while is you have 26 parts to your spine, and every once in a while, these are your vertebral bodies. One's going to move a little bit. Could be from like an acute lumbar sprain. You reach in the trunk to get the spare tire out. Something happens, and something is forced out of its natural position. This will impinge nerves. The nerves will communicate with the muscle. The muscle will spasm and protect the body.
Get inflamed, it starts to hurt.
Absolutely, but when the nerve is impinged, it kind of communicates with the muscle, and the muscle fires and it spasms. And its job is to keep that vertebral body from moving further and doing more harm. But it's a vicious cycle. So the job of the chiropractor or the Tui-Na practitioner is to adjust, push that gently back into its normal position, to coax it back where it knows it should be. And this takes the pressure off the nerve, the impingement is not there any longer, the muscles relax, and everybody's happy again. Periodically, these things have to be reminded, and that's, again, one of the functions of a good Tui-Na practitioner.
All right, and so let's hold the thought. We'll get some more questions, but let's now go out to the East West College of Natural Medicine and see a treatment using Tui-Na with Dr. Brandon Fuller.
All right, welcome back. We're here in our student theater, and Dr. Brandon Fuller is going to demonstrate a Tui-Na treatment on Amanda.
Thanks, Russ. We're here today talking about Tui-Na, and Tui-Na is a form of Chinese massage, but also intertwined with like chiropractic. It's like what modern day chiropractic might be. So Tui-Na, although we can't specifically do this in the U.S., is in the forms of bone setting adjustments, physical therapy. What we can do is different things, different procedures, such as rolling. So we can manipulate and we can move and have different pulling and grasping techniques. This is a great way for helping inflammation in a specific area. Some of the benefits that are seen throughout Tui-Na is things like breaking up fascia in specific areas. And now fascia is a connective tissue that lays just below the skin and just above the muscle, right? And it keeps that skin and muscle connected close to each other. Well, what happens in specific incidences is that fascia becomes combined. It kind of clumps together. And Tui-Na is more like a rigorous deep tissue massage, and it helps break up that fascia and allow movement, circulation, right? So we say energy gets stuck, it won't flow. But this will also help lymph flow. This will also help blood flow in the area and get healthy, nutritious blood right to where it needs to be, right? So the use of different techniques like what I'm doing here is going to help break up any of that fascia in this upper back area and help relax the muscles, help ease any tension or pain that we're doing, and help that blood flow in here. And then what'll happen is Amanda will feel this deep relaxation set in over her, right? Now, granted, I did say it was like a deep tissue, right? So there are going to be some areas where we do Tui-Na, and she might experience a little bit of discomfort, like a deep tissue massage. When you're getting that deep tissue massage, say on your calves, you're going to experience, ooh, that's a little painful right in there. That's okay, right? The concept of Tui-Na is to be used for specific ailments. So although you see me doing this here today, I might do a specific area for a specific disease, right? So if Amanda had problems with her calf, or if she needed a treatment on a specific area, like on the stomach channel, I might do a specific style of Tui-Na that will affect that stomach channel and help her ability to heal. On top of this massage, we also have the ability to slightly manipulate, right? So, say with Amanda's shoulder here, maybe she has a little bit of frozen shoulder. Well, I can do Tui-Na techniques while I move her shoulder to help release muscle, help break up that fascia. This might be a really good technique for things like frozen shoulder. We see a lot of frozen shoulder on women around the menopause age in life. And so frozen shoulder gets this fascia, these adhesions that don't allow the shoulder to move the way it should. So the use of Tui-Na, the use of this movement, this manipulation, can help ease the treatments, help get blood flow, healthy blood flow into the area. On top of that, this helps in general just accelerate our acupuncture treatments. So why don't you come by and experience the benefit of acupuncture? Thank you.
All right, Dr. Wrench, we've just seen this treatment up close, but you want to make a point before we talk about what we've just seen about bone setting and clarify some things.
Yeah, just to be clear, in this country, in the United States, we clearly do not do bone setting as it is done in China. We do Tui-Na as a Chinese type of medical massage, often called meridian massage. But we don't do the classical bone setting. It is done like that in China, and it's quite frequently done. In this country, we leave that work to the chiropractors.
Right.
And
physicians in the ER, etc.
Sure.
Now, let's talk about what Dr. Fuller just did. We really got to see this technique being performed.
Yeah, he did a number of different techniques on his patient, and one of those was for, believe it or not, calming inflammation, relaxing, as we mentioned earlier, hypertonicity. When we have a term that we'll use called ischemia, and that literally means kind of blood starvation. And to give you an analogy, it can be lifestyle, it can be trauma, it can be exercising too much, it can be exercising too little. But blood is like nourishes muscle tissue and nourishes the body, and all the healing properties are within the blood. Periodically, through stress, strain, overwork, underworking for people that are very sedentary, muscles tend to almost, in a sense, be starved of blood. It's not circulating like it should. And the
like
analogy,
atrophy or something, or?
Well, no, I would give the analogy of a sponge that's been out of water for a period of hours, and it takes on kind of a cardboard feel. Then we dip it into the sink and we get it nice and moist. We can wring it out, and all of a sudden it's soft and supple again. So one of the things that we want to do through Tui-Na, through any type of good vigorous massage, is to move blood, encourage the movement of blood, right, through muscle fibers and so on, so the muscle becomes more supple. Hence, it's no longer in a state of ischemia or blood starvation, and it feels good.
Because when the circulatory system is running on all cylinders, the body is healthy, presumably.
Yes, certain things can impede that. One of those is, pharmaceuticals, a lot of them. One other thing is improper diet, lack of exercise, overtraining.
And of course, hardening of the arteries, other types of disease.
Yeah,
but
absolutely.
But overtraining, that's interesting. So you can overtrain, and then the blood can also be somehow affected.
And not only that, but let's take somebody I'll take me, because I hadn't worked out in a couple of months, went back to the gym, and like every time you go in, you overdo it a little bit. Next day, you're in agony.
Pretty sore.
You're going, oh man, I really overdid it. But you know, you're doing the routine you haven't done in 2 or 3 weeks, so you go in, you hit it hard, and then you have what's called a lactic acid buildup in the muscle tissue. It's like a waste product of exercise, but the muscles hurt, and you're going.
But isn't
"Man,
that
I
a
should've
good
gone
sign
easy."
when muscles are sore? Then that means you've trained them and they're going to rebuild?
It is, but in the case of somebody that's overdone it and they know they've overdone it, we would use a certain kind of Tui-Na technique. It doesn't have to be real invasive because they're already hurt.
Right.
You know, it would just be a very mild
But it can bring
thing.
some relief.
Absolutely, it can. Yeah.
Okay, well, don't go away. We're coming right back with more.
Opioids are now a public health emergency in Florida. So what have you been prescribed for your pain? East West College of Natural Medicine understands the age-old Eastern philosophy of natural healing using acupuncture, herbs, and massage. Here, we combine Eastern and Western healing that results in a unified solution, individually tailored for you.
Massage is a powerful tool. It can alleviate pain, heal injury, and support well-being. East West College of Natural Medicine can prepare you for a career as a massage therapist. Our curriculum combines Western and Eastern massage therapy approaches, and the program includes an internship and job placement assistance. Launch a career you can feel good about. Start at ewcollege.edu. East West College of Natural Medicine, nurturing careers in the healing arts.
Hello and welcome back. We've been discussing Tui-Na. I'm here with Dr. Wrench, and we saw that procedure, and one question I have is, does one have to disrobe to have this type of procedure done in the clinic or in the massage?
It's a great question, and absolutely no. And if you notice, the young lady who was Dr. Fuller's patient was in scrubs. She was actually a student at the college. And it is not necessary. Sometimes we will actually have a cloth or like a drape we'll put over it, almost like a sheet, and it's generally always done through that.
Through the sheet, so there's no skin-to-skin contact on like the back or something.
And there are types of Tui-Na blankets that they use in China and so on. So this is not something that you have to do, not at all.
Okay. Let's talk about, in China there are physicians, they specialize in this ancient healing art and that sort of thing, but here, are there specialists
there may be. Moreover, though, there are acupuncture physicians who have kind of cross-trained in Tui-Na, as it is a part of the curriculum at the college.
And when we talk about acupuncture treatment, is this part of is Tui-Na part of it, or is it more adjunctive?
It's an adjunctive therapy that falls under the umbrella, if you will, of Oriental medicine.
Okay.
So you have an acupuncture treatment. If we feel that Tui-Na is right for you today, then that may be something that we would include in the treatment.
Now, could you do that same day that you get acupuncture?
Oh, absolutely. You may begin with one and end with the other. Generally, you have your acupuncture first, and your Tui-Na may follow it. Might mention, too, also that Tui-Na, performed as it is in China, is actually a form of preventative medicine.
So, like maintenance, making sure your body is healthy. So even if you're not sore, you could go in for Tui-Na, and this is to prevent injury or to prevent soreness.
Well, absolutely. And some of the benefits are it improves circulation, and most any good massage does that. So we increase blood flow, and as we said, with the blood comes all the healing properties. And so it moves lymph through the lymphatic system. It gets rid of we talked about the waste product. The lactic acid helps disperse that and so on.
Now, as far as feeling, people, when they say, oh, I need a good massage, is it more of a pressure, or does this a genuine comfort when you're getting a Tui-Na treatment?
I think Tui-Na probably does. While it isn't uncomfortable, there are, as Dr. Fuller alluded to, there are certain techniques that can be a little invasive. Again, like any person receiving a massage, you just have to communicate with the practitioner and say, that's a little deep. Sometimes they have to get into the tissue a little bit more. But in terms of a Swedish massage, I think most of us that have had one, we're almost sleeping through the process. Sometimes with Tui Na, it's a little invigorating, and there's a lot of little rapid hand movements. There's pulling, pushing, pressing, we call drilling, rolling, tapping, and cupping, and things like this
Now,
with a
what
hand.
about the elbow? I see that in massage
It does
treatments
play a part.
times.
So, but primarily in Tui Na, we use fingertips and thumbs.
Okay.
We use what's called the thenar eminence of the hand and the hypothenar eminence, the palm of the hand, the forearm, and the elbow. And of course, the elbow, you get in there a little bit deeper, and so
Right.
that's why I said it can be a little invasive. Generally, it isn't necessary, though.
Now, how long, I should say, might a Tui Na treatment take?
Again, it would be dependent upon why are we seeing you and why is this particular treatment necessary today. But I would say as much as as little as 15 minutes, and probably at the outset at the
Up to a 30-minute
treatment, 15 to 30.
Okay. So you could, and if someone is undergoing Tui Na, is this like some of the, like an acupuncture, maybe 2 days a week, 3 days?
Yeah.
Does it just depend on the patient?
It would, whether it's being done, a preventative measure would be maybe 1 day a week. If we have a acute or chronic situation, it may be 2 days a week.
Now, when I think of massage, you just automatically go to the back, but could this be on, like, let's say the calf or your upper arm if you've been training and your biceps are sore? Could this simply be even your chest muscles if you bench and maybe you pulled a pectoral or something? Could this be used pretty much at any part of the body where the musculoskeletal system?
Absolutely. Let's take something that's very isolated, like you're an avid tennis player and you got the classic case of tennis elbow. Absolutely, you could just work on that. Again, when we go to a massage therapist, generally, and for the most part, it's the whole body. They hit most of it, unless you have, my troubled areas are from my neck down, my low back. But unless you specify, you usually get the whole body. Tui Na, usually you don't. You get the area that we need to treat specifically.
Yeah. Now, is Tui Na part of the curriculum of East West College? You teach so much over there.
Yeah, it is. It's another one of the healing modalities that the students will study. They'll have 2 full terms of it. And then after graduation, continuing education units are available for those that want to really pursue that.
Is this something that you get a certificate for if you want to specialize in it like they do in China, or is this part just of a broader range of what these students are going to train in?
No, this is all part of the acupuncture physician program at the college.
I see. Now, let's try to drill down as far as Tui Na for people who have never done it. Can you just walk in the clinic and say, I'd like to undergo some Tui Na, or would you want to do a workup and a questionnaire?
We would do a full intake and determine if that's right for them or not. And currently at the college we have massage available. We have a massage program available for the person that just wants a relaxing massage or stimulation via that vehicle. But the Tui Na is a little bit more specialized, and it would usually be as an adjunctive therapy attached to an acupuncture treatment as a rule.
All right, well, we're almost out of time. Let's let the viewers know where they can get more information on the college, your website, etc.
Sure. Well, we're in Sarasota in our 22nd year. You can reach us at 941-355-9080. Call our clinic. We'll be happy to schedule an appointment for you there.
Absolutely. And so Tui Na comes from dating back to the
1700 BC.
Yes,
Yeah.
and it's really evolved through the course, and it's a big part of what you guys do at the college, in addition to all the other things, and people can come and see you whenever they want.
Absolutely.
Well, that is going to do it. We'll see you next time.
Massage is a powerful tool. It can alleviate pain, heal injury, and support well-being. East West College of Natural Medicine can prepare you for a career as a massage therapist. Our curriculum combines Western and Eastern massage therapy approaches, and the program includes an internship and job placement assistance. Launch a career you can feel good about. Start at ewcollege.edu. East West College of Natural Medicine, nurturing careers in the healing arts.